Hello, everybody, and welcome to the 2024 IIGH Student Symposium. On behalf of the USC Institute on Inequalities and Global Health, we're so excited you could all join us to showcase and celebrate the incredible efforts from this talented group of students who are all working to advance global health equity during their studies. My name is Taylor Burkholder, and I work with IIGH as the Director of Academic Programs. It is my pleasure to MC this student symposium alongside IIGH Project Specialist Caroline Diamond today. For those who might not be as familiar with the Institute, I hoped to briefly give an overview of who we are before we dive into this exciting program showcasing the work of our many student partners. Toward a vision of a more just and healthy world, IIGH is on a mission to work with partners around the world to address health-related disparities and inequalities through research, education, and public policy. Next slide, please. We have a wonderful team of people that are dedicated to that mission shown here. I wish we had time to introduce you to them all, but please do check out their biographies on our website and reach out if you have any questions. Next, please. At IIGH, we conduct our work through three main pillars: research, education, and policy. But as you'll see in this presentation today, there's important crossover between all three of these pillars. Education here is deeply tied to both research and policy. Next slide, please. For the past 5 years, we've had four main focus areas that have guided much of our work. These included sexuality, gender and rights, sustainability, power, poverty and mobility, urban health, and communications technology and innovation. You'll undoubtedly hear these themes come up multiple times in the work of the students during their presentations today. Next, please. IIGH works on the global, national, regional, and local levels, as you can see in this map of our projects, programs, and partnerships. Our work and partnerships span 5 continents, but we acknowledge that global is local and local is global, especially where we're based here in the very global city of Los Angeles. Next slide. And across all of those sites, we have a myriad of valued partnerships shown here, from large multinational organizations like the WHO to civil society organizations, foundations, corporate partners, and other universities. IIGH prides itself in approaching partnerships with the lens towards equality. Next, please. So today, we'd like to highlight the impact of educational programs at IIGH, shown here is the Geneva course. The Institute works across USC with our partners around the world with the goal of training future leaders in global health, and I'm thrilled to be hearing from many of those future leaders here this hour. Next, please. I'm excited for you to hear about the many opportunities for our students to get involved with the Institute today, but shown here is a list of many of those opportunities that we offer. These range from classroom to field-based immersive learning experiences. For funded fellowships, we'll soon hear more about our treasured Bremen Global Health Immersion Fellowship and the newly minted DC Summer Global Health Policy Scholars. We'll also hear from the Sexual Rights for Social Change Fellowship. We offer courses for undergraduates and graduates, online short courses, and immersion courses like the Geneva program. We sponsor the USC Global Health Case Competition annually and support the winning team to compete nationally. And we have opportunities for internships, research, the Student Advisory Council. All of these experiences and more are advertised in our newsletter. So this is a plug. Please be sure to visit globalhealth.usc.edu and subscribe if you haven't already. As I get ready to turn it over to Caroline Diamond to kick off the remaining schedule for our symposium, I wanted to remind everybody to use the Q&A function for this Zoom today. You can send us your questions and we'll try and save some time at the end to respond, and some of our panelists will respond in the meantime. So with that, over to you, Caroline.
Thank you so much, Dr. Burkholder. Hello, everyone, and thank you so much. My name is Caroline Diamond, and I work as a project specialist with the Institute, where my role is focused on student programming. We have a packed program today to share with all of you the many different opportunities with the Institute and introduce you to some of the amazing students we have the privilege of working with and learning with. Today, we'll discuss experiential learning, our sexual rights work, research, fellowships, and the Student Advisory Council. And with that, we'll jump into our first mini panel on experiential learning. Please welcome Iris and Arena, 2 students who participated in our PM 589 Global Governance in Diplomacy and Practice course, and Mara, a graduate of USC who was on the winning team of last year's USC case competition. Just to share a bit about both experiences, PM 589 offers students a unique opportunity to explore global health policy, research, and advocacy. In this course, students meet several times in the spring semester and then travel together to spend 2 weeks in Geneva, Switzerland, in conjunction with the World Health Assembly, the highest level health policy setting body for the world. There, students meet with policymakers, practitioners, civil society, and government representatives, and networks engaged in shaping global health, and are immersed in the international processes that shape global health policy and funding priorities. The annual USC Global Health Case Competition brings together teams of students from all disciplines and from across the university to tackle a critical global health challenge. Each year, the competition is held in February with a unique case of global and local relevance. The winning team is then funded to travel to Emory University, Atlanta, Georgia, for their international competition. So to start, I'll ask that each of you introduce yourselves briefly, your name, area of study, and any current work of note, and then we'll move into the rest of our panel. Iris, let's start with you, and then we'll move to Arena and Mara.
Hi everyone, my name is Iris, pronouns she, her, hers. I am currently pursuing a Master of Public Health with a concentration in global health. By training, I'm a nurse, but when I'm not working, I'm assisting a permanent supportive housing facility in downtown LA to establish partnerships with local community organizations as part of my practicum. Within my hospital, I'm actually working on educating my coworkers and healthcare workforce regarding homeless individuals, SDOH, and external circumstances that limit access to their quality care. And I'm doing that via workshops, hygiene kits, and just creating a dialogue.
Hi, everyone. My name is Marina Margadichin. I recently graduated from USC's MPH program, and my concentration was also in global health. And I'm currently working as a clinical research coordinator at CHLA during the daytime. And then I also conduct research with an organization that I worked with through the course of my practicum called Alzheimer's Care Armenia, and that's more of a global health research in the country.
Hi, everyone. My name is Mara. My pronouns are she, her, hers. I was a law student at Gould. I recently graduated and took the bar, and now I'm in New York working at a big law firm. Thank you. I previously also acquired my MPH. So I, in the past, did work with African and Caribbean immigrants and refugees, primarily in sexual and reproductive rights, and then also with elderly people with Alzheimer's or dementia. Now I'm just working on a number of corporate matters advising healthcare institutions.
Great. Thank you all for sharing. In the same order, can you each share the most meaningful thing that you learned in either the Geneva course or for Mara in the case competition? And maybe, Mara, it would be helpful if you gave a little bit of background on what the case was this past year as well.
I would say what I learned is the absolute importance and value of teamwork. As cliche as it sounds, I witnessed many different people of different backgrounds, languages, cultures, experiences coming together for world-changing purposes, right? So, for example, we spoke to SRI. It's a sexual rights initiative. So they're a coalition of national and regional organizations based in Canada, India, Egypt, and they're working to advance human rights related to sexuality at the United Nations. So they're pivotal in terms of contributing to the work of Human Rights Council, special procedures, and Universal Periodic Review. So there's many more organizations that we met, and we got involved with in terms of their work. But I would say how pivotal it is to get together as passionate group of people for the betterment of the world.
Thank you, Iris.
I think my answer is also going to echo some of what Iris said. But we got to work with a lot of intergovernmental organizations and then government leaders. And so we got to see a lot of constantly changing geopolitical landscapes. And then we saw also the complexity of diplomacy and health governance and all of these things. But in the midst of all that, I think the most meaningful thing was like watching people come together, and it really affirmed that fact of our willingness to come together and collaborate has this like incredible potential to enact real change for the health and well-being of people around the world.
Okay, yes. So the case competition, I'll start by giving you all a bit of background, at least on the USC front of what the case competition looked like for us. So we were a nonprofit group. and we were assigned the duty of considering an issue regarding Navajo tribes. And as a nonprofit, we had to think about how to protect families impacted by uranium exposure and groundwater contamination. And we basically came up with a health action plan to address some of those issues, like mental health issues that could flow from that, or climate injustices that the Navajo Nation may have been experiencing. And our team was comprised of, I think there were 5 of us, and we came from a number of different parts of USC. We had 2 medical students who were also getting their MPH, and then an MBA student, and of course myself. And I think my greatest takeaway, I would say, is the importance of building an interdisciplinary team, and leaning on each other's strengths to research or ideate or package a proposal on how to solve this complex health problem. Obviously, we were very successful and were able to advance to Emory's case competition, and it was a completely different issue. But I think that takeaway was critical in our success moving forward.
Great. Thank you all so much. And I think really key to why we wanted to bring all of you together is to think about what the value of experiential learning is. I think both the PM 589 course and the case competition is a really important example of how you take classroom learning and then kind of build on that with on-the-ground experiences, with working with one another, collaboration, meeting key people, and yeah, taking your learning, I guess, to the next level. So I was wondering if, let's start with you, Arena. Can you talk about the value of experiential learning, and maybe specifically for yourself in how you've been developing in your MPH program?
Sure. I think in this area, especially global health, it's essential because you're dealing with so many people from different backgrounds, different cultures, different politics in the countries. So I would say I'll reflect on my experience within the Geneva course specifically. It, as Caroline mentioned earlier, we meet with the class prior to going to the World Health Assembly, and we discuss all the agenda topics that are going to be discussed. We do research on the organizations we're going to be meeting with, or the countries that are specifically involved in certain things. That's one thing. And then to be in the country, really sitting at the table with these inspiring people, actually engaging in a conversation with them, being an active participant in these discussions is entirely a different thing. I think it's so captivating. You get involved yourself, you start to, build your own stake in it, and then you want to offer your own solutions. So I think if it wasn't for being present in that moment, I think it would have really affected that learning experience.
And Iris, do you have anything to add?
Yeah, just something small. What I kind of learned is I felt like 20 to 30% of global health work is what we learn in school, right? They prepare you as much as you can. And then about 70 to 80% of it is learned through the field, through the experience, kind of what we felt when we were in Geneva. It's learning from others, making mistakes, creating the networks, partnerships, or meeting with people who don't have the same beliefs or ideas as you, but finding that niche of where you both can work together. So I think with experiential learning, it's starting that 70 to 80% as early as you can, because really there's immense value in preparation and putting yourself out there sooner rather than later.
And Mara, what do you have to add on this point?
I echo a lot of the sentiments that my peers already shared, but I guess one thing I would add is, at least for us as members of a case competition where you're trying to communicate your pitch and make sure that you can get a grant to support your community's needs, the most important thing for me was learning that your ideas were only as good as your ability to communicate them. And I don't think I would have picked that up so much in the classroom setting if it were not for this type of experience.
Thank you. And Mara, just to stay with you, what is one takeaway from this experience that you would want to share with other students, or advice you have for students interested in the case competition experience?
I think that in the classroom, we learn very quickly that global health problems are multifaceted. But I don't think that we have the same level of accessibility of working with an interdisciplinary team, at least as in my case, as interdisciplinary as our team was. And something like the Global Health Case Competition presents an incredible opportunity to think about interventions in a way that you may not have been familiar with, and to hear from other teams about what sort of novel plans that they come up with. I think that aside from our own preparation and presentation of the plan, it was the other teams that I learned the most from, because I never thought to think about the problem in that way, or my team and I had not ideated in that way. So I think it's an incredibly valuable experience, and I would recommend it to anybody.
Thank you. And Iris, what about you from PM 589?
I would say my advice is to just go for it, whatever you want to apply to. If you feel like you don't have the qualifications, if you feel like your resume is not good enough, I would say to put that aside and just go for it. Sometimes you are your own obstacle and you don't know what you're missing out on. Because I was that person. I was so close to not applying to it and I just did it. And whatever outcome happened, I was okay with it. And I also truly believe that a no is not just a no. It just means maybe there's more out there for you to explore and to apply to. So don't be discouraged. And I really do believe that if you care for your community and you care about making a difference in the world, then that's enough proof that you are good enough. So just apply for whatever you have in your mind, just apply for it.
Thank you so much. And Arena?
I'll take it from when you do get accepted. Definitely pack your networking boots. No shyness. You're not going to need it in Geneva. You get to speak to such incredible, amazing, accomplished people, and you will be definitely very nervous because you won't want to go up to the Minister of Health of a different country and introduce yourself. But you need to get rid of the imposter syndrome. You are there to enjoy that experience and learn from that experience. And once you get over that hump of like shyness, our cohort has some incredible stories from who they've got to meet, who they've got to get a one-on-one interview with. And it's just an incredible once-in-a-lifetime experience. So you've just got to risk it all, I guess.
Thank you all so much for your reflections. I really, really appreciate it. And we're going to transition into our next mini panel. I'd like to welcome Aaliyah and Maya, two students working on sexual rights topics with the Institute. Both Maya and Aaliyah participated in our Sexual Rights for Social Change Fellowship program in the summer of 2023, and then for Aaliyah in 2024, and are now youth ambassadors. The summer fellowship program focuses on developing communications and messaging tools to advance sexual rights and health, with the opportunity for students to engage in research and content creation that advances the dialogue around key issues relevant to sexual health and rights globally. Aaliyah will be sharing about her fellowship experience today. And after students graduate from the fellowship, they are eligible to apply to be youth ambassadors, where over the course of a rolling 12-month term, they engage in a wide variety of projects aimed at improving the discourse around sexual health, rights, and pleasure for all young people globally, while also receiving capacity building and mentorship opportunities. And Maya will be sharing about her role as a youth ambassador. So to start, I'll ask that you each introduce yourselves briefly, name, area of study, and any current work of note. Aaliyah, let's start with you.
My name's Aaliyah. I'm currently a senior at USC. I'm studying global health for undergrad, and then I'm also working towards my MPH through the progressive degree program at USC. I'm super interested in sustainability as well as sexual health, so a lot of my work kind of follows that intersection. And I also have a fashion minor, so I love kind of drawing from the arts and the creative side of me when it comes to these types of issues.
Thank you. And Maya?
Hi everyone, my name is Maya, pronouns she, her. I'm currently a junior in undergrad studying global health and also working on my progressive degree master's of global medicine. I started off my involvement with IIGH as a fellow for the Sexual Rights Academy 2 summers ago, like Caroline mentioned, and I'm a youth ambassador now.
Wonderful. And Maya, will stick with you. What is the most meaningful thing you've learned while being a youth ambassador?
I would say the most meaningful thing I've learned as a youth ambassador so far is the importance of and the power behind collaboration and conversation. Through my role as an ambassador, I've been able to engage in so many meaningful conversations surrounding sexual health, sexual rights, advocacy, whether it's with my other fellow youth ambassadors or other incredibly passionate, knowledgeable individuals in the sexual rights realm. And these conversations are what fuel my passion for this field. And these interactions just continuously inspire me to be a better advocate for sexual health and rights. And I think that collaboration with others in this realm of sexual health advocacy and having these meaningful conversations are at the core of this work and us making a change.
Thank you, Maya. And over to you, Aaliyah, with the same question.
I think over the summer, the biggest thing that I learned was there's always a link to sexual health somewhere out there. So I think one of the topics we talked about in the academy was climate change and how climate change is actually a gendered issue. Women are disproportionately affected, and that leads to a lot of things like increased sexual violence. And just hearing and learning about those types of things just reminded me that sexual health is a lot broader than I anticipated. When I came into the academy, I thought that there were certain topics and certain angles that I already kind of knew about that I would just deepen my understanding. But through the academy, I learned that it's actually so much more broad than I anticipated. And it was really cool hearing how different people in different fields incorporated sexual health and sexual rights in their respective fields.
Thank you. So today we're going to switch up the format just a little bit, and we're going to share 2 reels with everyone today. So the first is going to be from Aaliyah, which she made during our fellowship week on pleasure in connection to comprehensive sexuality education. Caitlin, can you share the video?
There are lots of things in life I think are pleasurable. Really good fitting jeans, sunbathing in 75-degree weather, perfectly ripe avocados, and sex. Sex is supposed to be pleasurable. During my California public school education, no one actually taught me that. In fact, most comprehensive sex ed classes don't teach the P word, pleasure. California's 2016 Healthy Youth Act helped ensure access to sexual education, but it followed the same path many previous curriculums and standards have focused on, risk prevention. When sex ed is approached through a negative lens, it fuels fear and shame, preventing young people from knowing how to engage in healthy relationships. Lack of pleasure-based sexual education undermines current curriculums. Pleasure is human nature. Pleasure reinforces the ideas that most sex curriculums already teach, healthy and positive values about body, puberty, relationships, sex and family life, as well as the absence of disease, pain, and stigma. It's time California stopped shying away from teaching the word pleasure and updated its sex ed curriculum. Pleasure is not a one-size-fits-all, but finding pleasure, just like a pair of good-fitting, sexy jeans, makes life a whole lot better.
Great, thank you. Aaliyah, can you share a bit about the topic and why it's important? And specific to this fellowship, what communication tools you learned that you then wanted to use in this video?
Sure. So this topic is actually my favorite topic when it comes to sexual health. This is the angle that I have chosen to do a lot of my work, and it's just pleasure. It's approaching sexual health from a pleasure perspective. And like I mentioned in the video, a lot of public school education, including California, kind of falls short when it comes to comprehensive sex ed. And comprehensive sex ed means a lot of things. And California treats it as simply an education that informs you of the risks when you partake in sexual behavior. And it doesn't inform you of all the pleasures and all the wonderful things that come out of sexual relationships or just positive, healthy relationships in general. And so I chose to talk about the 2016 California Healthy Youth Act. I chose to kind of talk about how, in my education going through the California public school system, how I felt like it kind of felt short. And these were kind of strategies that I learned directly from the academy. We were taught to incorporate our own stories, which is something that I felt like throughout my time at the academy, I really blossomed. The first video I made was I was very scared. I didn't know how to talk about my own relationship with sex or my own relationship with sexual health. And then this was the last video I made it was a lot easier for me to say things like pleasure, to say things like sex, and it just kind of gets easier as time goes on. But I really draw from the communication strategies that we were taught. And that's really staying true to your voice and understanding that your story is your why. And as long as you can connect that why to what you're doing, then you're good to go.
Thank you so much. And now, Caitlin, can you share Maya's reel? This reel is a day in the life of a youth ambassador at the AIDS conference in Munich, Germany this past summer, where 3 ambassadors joined us to conduct interviews with other young people about sexual health, rights, and pleasure, and attend sessions in the conference Global Village.
Come along with me to the 2024 International AIDS Conference in Munich, Germany. I'm Maya, I'm a global health student at USC, and here with IIGH as youth ambassador. Let's get the day started.
Bright and early at 7 a.m., I got up, looked at the beautiful view off the balcony, got ready for the conference, had a little snack, and then it was time to go. Every morning we've been having a morning check-in, so we walked through the forest to get breakfast, debrief, get ready for the day, and it was time to head to the conference. This morning we started off by conducting interviews. I was with Kaya today. It's been absolutely wonderful to meet so many amazing people. Then we headed to some panels. This one was about HIV, age of access, and policy.
The next panel was a film about a man living with HIV, and it was incredibly well done. After that, it was time for a lunch break, so Kaya and I got some wraps by the water and spent the rest of the afternoon exploring the global village.
I feel so lucky to be able to be here surrounded by such passionate and accomplished people.
After finishing up the conference for the day, we headed home, had a nice beautiful walk next to the farmer's market, and it was time for us to explore the city. We headed on over to Old Town, watched people surf in the river, walked around the English Garden, and just enjoyed the view Munich had to offer. For dinner, after realizing that the kitchen closes quite early on in the night, we were finally able to find a restaurant that could seat us, and ended up having this delicious food. We headed on over back to the hotel, and we ended our night there. Hope you enjoyed, and thanks for following along.
Thank you so much. I love this video every single time I watch it. Maya, can you share a bit about the focus of your video, why it's important, and maybe some of the key things you learned while in Munich?
Yes, so as you can see from my reel, I had an absolutely wonderful time at the AIDS conference this summer, and I learned so much about what it means to be an advocate for HIV, AIDS, and sexual rights. I would say it was one of the first times that I was surrounded by so many inspiring, passionate, young advocates. And one of the biggest takeaways from the conference was that learning about this topic of HIV and how important it is for us to educate ourselves on it, and the importance of HIV advocacy, continuing to raise awareness, break the stigma, and continuing to just engage in and start more conversations surrounding this topic of HIV and sexual rights. My personal topic of focus at the conference was on storytelling, and through this lens of storytelling, I further realized how powerful these stories of people living with HIV are and how more people need to be hearing this. And I think this can be done whether through highlighting these stories through comprehensive sex education, more coverage in the media, or even just in casual conversation. And just a huge takeaway I had was that we all need to be talking more about HIV to continue to normalize it, learn more about it, and all become better advocates.
Thank you. And with our final few minutes, can you both share your advice for other students who may be interested in the Sexual Rights Academy, which will be running this upcoming summer 2025? Aaliyah, why don't we start with you?
Sure. So my biggest piece of advice is that some days it's going to be really easy, and then sometimes it's going to be a little difficult. And what I mean by that is because sex is such a taboo topic, and inadvertently sexual health then becomes taboo, regardless of how you approach it, whether you're approaching it from a health perspective or a rights perspective, or like I choose a pleasure perspective, there's going to be a little bit of resistance, whether it's from internalized societal, attitudes or actual people in your life who are going to question why you're doing what you're doing. And there's going to be moments where you're in a room full of people and saying sex and anything that goes with sexual health is really easy. And then there's going to be days where it's a little bit harder, it feels a little bit weirder, but just to kind of get over that hump and realize that what you're doing is important and this work has to be done. And if you're not doing it, then no one is doing it, so someone has to be doing it. And I think something that I really loved about the academy was that everyone was super passionate, so it made it a lot easier to kind of get over that internalized stigma of, am I even supposed to be here? Should I be saying this? Should I be talking about this?
Yeah, because you're all learning how to talk about these challenging issues together. Maya, do you have anything else to add?
I think my advice would be people who are interested in applying for the Sexual Rights Academy. I would say apply if you have absolutely any curiosity or interest in global health, advocacy, digital media advocacy, sexual health and rights, anything like that, because I went into the program with little to no details on the nitty-gritty of sexual health, rights, or advocacy. I just came in with a true passion and an interest in the topic in the program, and I ended up learning so much. So I would say just apply if any of this sparks even just a little bit of interest. It's such an incredible experience, and it was one of the best decisions I've ever made to apply.
Thank you both so much. And we're going to transition into our next presentation, which will be from Maggie Colcino, who will be giving a short presentation on her research experience with the Institute. Maggie, please introduce yourself and then take it away. Caitlin will be sharing your slides, so you can just ask to advance whenever you're ready.
Perfect. Hi, everyone. My name is Maggie. I am a senior at USC studying global health with a minor in natural sciences. If you can go to the next slide, you can see a whole overview of my involvements with USC. So as I said, I'm a global health major. My pronouns are she, her, hers. My involvement specifically with IIGH is that I'm a SAC member, so a Student Advisory Council member for this year. I'm also going to be talking about with this presentation my research commitments with IIGH. Other involvements at USC involve volunteering, philanthropy work. I'm also involved in clinical research, but I think global health research is like by far my favorite way to be in research. So that's why I'm really excited to talk about it today to you guys. So next slide, please. So what exactly do I do with the IIGH? So my project specifically focuses on the One Health initiative, One Health framework in Uganda. So what is One Health? One Health is a multidisciplinary framework that looks at the interaction between people, environment, and animals. And it recognizes that keeping all of these things healthy is important for the health of our planet and the health of our human population. So my project applied this framework to Uganda and specifically neglected diseases. So some goals of my project were gaining understanding of the natural history of the diseases that are listed above, also gaining understanding of practices, norms, and behaviors in local communities that drive animal to human transmissions. And finally, there was a policy piece to my project, which was focusing on specifically One Health policy in Uganda and examining it at the way it's currently working or not working, identifying any shortcomings, and then guiding some new policy implementations which can improve health of people and animals in these communities. So next slide, please. So specifically, kind of I'm going to be talking about like just the general timeline of my involvement with this project. So I joined the lab when we already had the data, and the data for this project included interviews. So what I was involved with in the first probably year of my work with this lab was just coding interviews, and I used this lovely software in Vivo, which allows you to read different key informant and group discussions. And then you can, using a code book that my lovely mentor, Sarah Moto, developed, I would sort the data into different like codes so that by the end of the coding phase, you can look at all the data that you have arranged by like different themes. And then you can go into each theme and analyze like, oh, like how is exposure different by gender? Is exposure different by like profession of a certain community member? So this was the first part of the project. It was personally my favorite part of the project because you really get to hear what people think about disease transmission, what different norms, behaviors they have, and like how it's different from like where I grew up, for instance. And it's really where a lot of the things that I learned in my global health classes like manifested in real life. So this part of the project was very exciting to me. And then if you could go to the next slide. So yeah, the second part was specifically analysis. And so the way, again, as I mentioned before, now that I have all this data coded into different codes and themes, we as a group went in and picked, my group specifically picked gender. So we read that specific column, specific code, picked up important quotes that could tell us that could let us know some information about the relationship between gender norms and the rate of exposure to zoonotic diseases. So that was the part of the project that I was working with Sarah Moto. And then the next part was specifically policy related. So I looked at, again, the policy codes, and these were just like governmental officials. They were asked some interview questions about the implementation of One Health strategic plan, and asked about their opinion on like shortcomings, or is it working, is it not working? So what I did, again, I read these interviews and then I compared it to the actual goals that the government had set for the One Health project. And then I identified the places where these kind of interviews didn't meet the goals. So then I created analytical memos for that. And I think this was also just a very, very cool, important part of the project, just because like it kind of connects to global health governance. And I think governance is very important because it actually, well, it's a way of implementing actual change in the community and seeing how the government plays a role in like global health and improving health outcomes of the people. And then if you go to the next slide, so just some like future directions. My goal as a student, I really want to pursue an MD PhD. I think researching in global health has opened a whole new world of the importance of public health, of the importance of behavior, and how it contributes to onset of disease. So I really, really want to keep pursuing that as a physician scientist. And I also have some advice for getting into global health research. So here are just a lot of ways that you can get involved in the IIGH. And to me personally, that's how I got involved in this laboratory. I went to a UCLA Global Health Conference. I volunteered there a few years back, and I saw a lot of presenters. I saw a lot of posters. I saw a lot of exciting research happen in the global health field. And that was like eye-opening to me. And I never really thought that I would be here talking to you guys about like my work. But so yeah, maybe just first finding out like what is out there and what are the different ways you can get involved in global health research. There's a lot of seminars that IIGH hosts monthly. I would also follow global health news to see like and pick which topic you're more passionate about. And then yeah, apply to be a student advisory council member, because I think that's probably one of the best ways to have a direct impact on what the Institute is doing. But yeah, thank you for letting me talk to you today about my research.
Thank you so much, Maggie. I'll now pass it over to Dr. Burkholder, who will moderate a short panel on fellowships with the Institute, and we'll conclude this section with a reel from one of our fellowship students.
Wonderful. Thank you, Caroline. Thank you, Maggie. So I'd now like to invite 4 panelists to discuss their experiences with funded fellowships here at IIGH this past summer. But before I do, please don't forget to send us your questions for any of the previous panelists or Maggie, or for the panelists who are about to start. Use the Q&A function and send us your burning questions so we have some interesting things to talk about towards the end of this presentation. So in 2024, 3 students, Anju Kane, Rachel Bai, and Emily Mendonça, were our students that were selected for the very competitive Bremen Global Health Immersion Fellowship. Honoring the legacy of renowned global health figure Dr. Joel Bremen, and funded through a generous donation by the Bremen family, the Bremen Fellowship seeks to deepen students' engagement and approach to addressing health problems in low and middle income countries. This fellowship supports students interested in global health and public service careers by funding field, programmatic, clinical, and laboratory research experiences. Since Anju will be speaking to you a little later about the Student Advisory Council and wears many hats, we'll have Rachel and Emily joining us on this panel to talk about their experiences this summer. Also joining the panel are Jonah Phipps and Noah Green, who were the inaugural DC Global Health Policy Scholars, which is a brand new program that placed 2 Keck medical students with host organizations in Washington, DC this past summer in order to address a pressing global health policy need through scholarship specifically. So warm welcome to these 4 panelists who are joining us today. I'll start by having each of you introduce yourself and your current educational program and major, and also let's add the purpose of your fellowship project. We will start with Rachel and go to Emily, then Noah and Jonah.
Hi everyone, my name is Rachel Bai, and I'm currently a second-year medical student at Keck. So I was part of the Bremen Fellowship, and this summer I received the incredible opportunity to spend 6 weeks in Mexico City doing public health research. And my project was looking specifically at the effects of lead exposure, just community-lead exposure, during the peripartum time period, which is a time period before, during, and after giving birth, and the effects of lead exposure during that time period on cognition later in life. So when a woman is in her 40s or 50s.
Hi everyone, my name's Emily. I'm a fourth year medical student at Keck, planning on going into pediatrics. And I was very grateful to do the Bremen Fellowship this summer. I spent 4 weeks in Kenya, part of the time in Nairobi and part of the time in a more rural area, working with an organization called Action for Children with Disabilities, which is a disability rights advocacy organization in Kenya. And we were developing and piloting a curriculum on fetal alcohol spectrum disorders, which are the range of conditions that can occur due to prenatal alcohol exposure.
Hello, everyone. My name is Noah Green. My pronouns are he, him, and I'm a second year medical student at Keck as well. And I spent 6 weeks in DC with Jonah for the Keck Times IIGH Policy Fellowship. And over the summer, I worked with the US State Department, specifically the Special Envoy to advance the human rights of LGBTQI+ persons, producing a scoping review research project surrounding the topic of forced anal examinations, which is a torturous practice used by some governments to target and criminalize people based on their gender identity and sexual orientation.
Hi, everybody. My name is Jonah Phipps, pronouns he, him. I was a DC policy scholar with Noah this summer as well, and my project was focused on looking at policy surrounding HIV and AIDS initiatives, specifically in sub-Saharan Africa, and more specifically, how they included or excluded older women, that is, women over the age of 50.
Wonderful. And so as everyone can see, there's a huge breadth and depth of different topics with these experiences that you've had this past summer. So I wanted to ask each of you, we'll go in reverse order this time. What do you think was the most meaningful thing that you learned from your experience with the Bremen Fellowship for you, Rachel and Emily, and with the DC Global Policy program for you, Noah and Jonah?
I think the most meaningful thing I learned is that we are there's huge space, there's huge room in this area for physicians to be invested in policy and research and writing. And I think that we kind of forget that sometimes when we focus on patient care, which is obviously critical, but that we also need to be working on these policy writing and communication initiatives.
I think the most meaningful thing I learned over the summer was the importance of leveraging others' expertise to navigate unfamiliar and challenging environments. This is my first time conducting research and working in like a policy setting. So there was a tremendous learning curve for me, but through asking questions, having guidance from great mentors, and working alongside Joda, I gained confidence and skills needed to thrive in a new area. So collaboration was definitely my biggest asset and allowed me to quickly learn skills needed to produce quality papers.
For me, I think there were a lot of things that I learned. When I think about the most meaningful, I grew up in Kenya, in the area where I conducted my project this summer. And my parents run a children's home there, and some of the caregivers from the children's home attended some of our pilot sessions for our curriculum. And there is actually a baby at the children's home who has fetal alcohol spectrum disorder. And afterwards, these caregivers shared with us that they felt very empowered to care for her unique needs, and they felt like they had a deeper understanding of her. And so I think this was just really meaningful for me on a personal level, but also because I think we are taught to think about global public health in a big picture mindset, right? We're thinking about the health of populations and kind of thinking about things more broadly. But each and everything that we do in global public health affects individuals, and there are individual stories in there. And so I just think it was a very powerful reminder for me of the value of this work that we're doing, not just on a broad scale, but on the individual level as well.
I think for me, I learned a lot because I had no experience in public health or global health, so I came in a completely blank slate. For me, I learned that public health, the most effective public health is rooted in the community that it serves. because for the research I was doing, I was working with a huge cohort study, which had been following this group of pregnant women, or when they were pregnant, in the 90s up until now. So it's been 30 years that they've been involved with this cohort. And on my first day there, my mentor told me the retention rate for the participants coming back to get health checks and to give us more information on their socioeconomic information currently. That retention rate was over 90%, which I thought was crazy because it's been a really long cohort study. But I soon realized why, and it was because this research offered so much services to these women. And in Mexico, it's hard to get a primary care visit. But the participants who came in, they would get everything screened. They would get DEXA scans for like osteoporosis, which is not something that's done at a regular family visit check. And they just received so many services, and the nurses had been working at the research center for also 30 years as well. So they knew the women well. They knew their children, they knew their grandkids, and there was that relational aspect as well. So the participants just like really enjoyed coming, and they enjoyed coming and learning about different environmental exposures and knowing that they were contributing to help protect the health of themselves and also future generations. And so I just really learned that public health is symbiotic when done right. And there's a shared understanding that both the participant and researchers have the same goal in improving the health of the community as a whole.
Oh, you can't beat that. It's so incredibly inspiring to hear the impacts that all four of your projects are having in the communities and with the partnerships that you've established in such a short time. I wonder for the next question, if we could turn the focus a little more inward, maybe reflect a little bit more on ourselves and what this fellowship has meant specifically, or these two fellowships have meant specifically to the four of you. So maybe starting with our Bremen fellowships, what do you see as the value of your Bremen fellowship project and the related experience that you've gained in the field of global health? We'll start with Emily and Rachel, and then I'll ask the same question of our two DC policy scholars.
Sure, absolutely. So fetal alcohol spectrum disorders are known to be common in many parts of the world. I had never heard of them before med school, but I was shocked to learn that in the US, as many as 5% of children may have FASD. And in some parts of South Africa, the rates are as high as 20 to 30%. But this is a condition that has been overlooked in a lot of places and really hasn't been researched and worked on. And Kenya is one of those places. And I think a big reason for this is just access to health information. And then there's also a lot of stigma surrounding this condition. So what we were able to do through our project was to demonstrate that there is a lot of interest in the area where we were working in learning more about this condition and finding ways of disseminating this information into the community. And that our curriculum was one model that might potentially work for doing that. We also started to identify some of the local traditional beliefs and practices regarding alcohol use during pregnancy, and really just build some new partnerships and networks with existing organizations that are working on related topics in the area. So this is valuable, I think, to the field of global health and me as well, because I think it lays a foundation for future work that could improve access to accurate health information about this topic and improve access to diagnosis and therapy for people with FASD in Kenya.
I think for my project, it was really relevant because there is a lot of community-led exposure in Mexico. Lead is present in gasoline, and it wasn't phased out of gasoline until I believe it was only a decade ago. So a lot of individuals in Mexico have been community exposed, which means they might have not even been exposed in high amounts through a certain occupation, but rather from daily living, just from maybe breathing in the air or being exposed to gasoline in their communities. So this was a really relevant and pressing issue for the locals in Mexico City that I was working with. And it's important because lead exposure has a significant impact on neurological development in kids. But for my project specifically, I was looking at the adults and the women who had been exposed while they were pregnant, just through community exposures. And there's really not a lot of research done on people who were exposed during the pregnancy time period. There's a lot on kids. There's a lot on people exposed through their occupations, but not on those exposed during pregnancy, which is an important time period because during pregnancy, there's a lot of bone breakdown, and lead, when you're exposed a long time, it's stored in your bones. So during pregnancy, if you already have been exposed to a lot, then it's like let out into your blood. And that can cause damaging effects later in life, such as cognition deficits. So when I was just doing the background literature review for this project, there was a lot on other populations and even on men who are community exposed, but not on women at all. So it's just there is a gap in research, and it's been really exciting, and it's been a privilege to get to help address this gap in knowledge.
Thank you. We'll turn it over to Noah and then Jonah as well.
Yeah, thank you. So my research project, I feel like, has opened my eyes to the hardships that people face, even if those struggles often go unseen or unheard, especially at the individual level. I feel like with my research, I'm trying to make a positive, lasting change, especially for the LGBTQ plus community, which I'm a part of, by uncovering knowledge gaps for the State Department, so they can have data to change policies and implement them to prevent the harmful practice of forced anal examinations. This experience, especially the global health aspect, was incredibly valuable to me as a medical student, because it kind of reminded me that as a future physician, it's my responsibility to make sure my patients that I care for feel seen, heard, and safe. And I may not know what hardships that they face just to get to the clinic. So just with this new awareness I gained, I plan on making sure that I can provide like a supportive environment for those I care for in the future. So this was a very eye-opening experience for me and the research that I was able to do.
So I think the value of this experience on one level for research and knowledge purposes, there's a stigma that old people don't have sex. Older people are not engaged in these activities, that they're not at risk for STIs, and the policy that we enact reflects that. And so there's a lot of value in doing research and trying to figure out how these populations are being affected by things like HIV and AIDS, and then trying to help remedy that. The value for me was that it really changed my idea of what a physician is. I always kind of knew about advocacy in the abstract, but now I can see and really want to include this kind of advocacy, this policy advocacy, this focus on language and communication in my practice.
Wonderful. Thank you all for sharing that. To wrap up this panel for right now, I wondered if you could share with us one thing you've taken away from this experience that you want to share with other students. Like, what advice would you give to those who are now interested in pursuing either of these two fellowships? We'll go Emily, Noah, Jonah, and Rachel.
Sure. So I think the biggest takeaway for me and piece of advice that I would share with others is the importance of mentorship. When I first got interested in the topic of FASD in Kenya, I had a completely different idea of what type of project that I wanted to do, which I had come up with all on my own with no input from local partners. And I had all of this energy and eagerness to get started right away. And thankfully, I decided to seek out mentorship. And I was really grateful to be mentored by Dr. Burkholder and Dr. Ferguson, who are on this call, as well as Dr. Hager. And they gave me very direct and wise advice to slow down, instead seek out a community partnership in Kenya and find out the type of project or the next steps that this community partner would recommend doing. And that made all the difference in the world in terms of what we ended up doing and how it ended up going, and really the value of the project to the community. And I just can't imagine how badly things would have turned out if I had just struck out on my own without that mentorship. So I would really just advise and recommend to students who are interested in global health to look for mentors early, and find people that you can reach out to about tough situations in your project, who you can run things by for advice. Because the mentorship really extended through the whole project this summer, where there might have been sticky situations that came up. I emailed Dr. Burkholder, and he was able to give me some advice on what to do, and Dr. Ferguson. And I think that, as students, we have a lot of energy and excitement about wanting to make a difference, but we don't have as much experience to draw on when we're trying to figure out how to go about that in the most effective way and the least harmful way possible. And that's really the value of mentorship. And I would just encourage students to just reach out to people, cold email them if you don't know them or have connections. And something that really made a difference for me was asking people that I spoke with if they knew anybody else that might be able to help me out, and try to build up a network that way.
Yes, I just want to second that mentorship aspect. I want to give a shout out to Dr. Burkholder and Cohen for showing me firsthand what it means to have supportive mentors and helping guide me through the summer research fellowship. And so advice is don't limit your goals or aspirations just because you feel like you may lack knowledge or experience. You have to start somewhere. So programs like the Bremen and the DC Policy Fellowship have mentors who are willing to invest in you and want to generally help you grow as a person. So make sure that you're aligning yourself with your passions and interests, and the experience and mentorship will come. And then also just making sure that when you do get opportunities to network, I feel like that's something that DC really opened my eyes to, which is the amount of network and opportunities that you can come across just by, introducing yourself to someone that you're sitting next to. So mentorship and also networking.
Dang it, no, that was what I was gonna say, and then you said the second thing I was gonna say. No, my takeaway was that you, as a researcher, as a student, bring a lot of value to these things. I think we sometimes get lost in trying to get experience and fit into projects, but your curiosity and your interests are what drive these things. And so, advocacy starts with self-advocacy. Do things that you're interested in, talk to people that you're interested in, and be brave, and you'll be fine.
I really agree with what Jonah said. I think a lot of times we as students will enter into situations where we may not have expertise or a lot of experience and feel like we're bringing down the team, but you really aren't. You can offload, or they can offload a lot of the work to you, and you're there to learn and help in the long term. I think for me personally, I learned from this, and also just from living in a new country for 6 weeks in general, is to not be afraid to jump into things you aren't prepared for. I remember the week before I left for Mexico City, I was freaking out because I was supposed to do this many flashcards of Spanish, but I hadn't finished them, and I was like, I'm screwed. But a lot of this experience you gain from being on the ground, from learning in the moment. There were no amount of Spanish flashcards that I could have done that would have turned me fluent in the week before I left. But yeah, I feel like it's good life advice in general to just not be afraid to just jump into things that you feel like you don't have experience for, as long as you're hardworking, as long as you're curious, eager to learn. That's all that matters. And I feel like the most important skill in global health work isn't even a medical degree, or well, that's important, but a medical degree, research specific knowledge, all these skills, but rather the ability to empathize, a genuine desire to understand others across language differences and across borders. I think it's that teamwork aspect.
Man, those are all incredible tips. And I was just thinking as you were talking, all four of you, that despite being a few years out of training at this point, those all still apply to someone in my position too. So thanks for suggesting those for everybody in our audience, myself included. So thanks again to this panel. Wonderful to hear your perspectives. To close it out, we will now play a reel that was produced by Emily, talking about her experience this summer in Kenya. I'll turn it over to Caitlin for that.
Good morning from Kenya. My name's Emily. I'm a fourth-year medical student at USC, and this summer I'm doing a Bremen Global Health Immersion Fellowship. Today we're piloting our curriculum with teachers from this school, Cornerstone Preparatory Academy, and other teachers from the surrounding area. Almost 40 participants came to the session today where we covered the basics of what causes FASD, how to prevent it, and how to support kids with FASD. We gave out these pamphlets with some of our key messages, as well as some strategies on how to support kids with FASD in the classroom. At the end, people filled out these surveys, which we'll use to improve our curriculum. Then we debriefed on the session over this delicious late lunch. After that, it was time to call it a day. Thankfully, my commute while I'm here is just a short walk from the school. Thanks for following along on my day in Kenya with the Bremen Global Health Immersion Fellowship.
Great. Thank you, Dr. Burkholder, and thank you all so much for sharing such wonderful reflections. And for our final section of the day, I'll pass it over to Anju Kane, the chair of our Student Advisory Council. Anju is also a Bremen Fellowship recipient and has chaired our Advisory Council for 2 years. Anju, over to you, and Caitlin will advance your slides.
Thanks, Caroline. So hi, everyone. My name's Anju Kane. I'm a third-year doctoral student in Keck and the current chair for IIGH's Student Advisory Council, which we call SAC. I've been a part of SAC for 3 years now, and for 2 of those years, I've been the chair. So I'm happy to be here and to just share a little bit more about SAC with you. And next slide, please. So in record-breaking time, I'll talk about what SAC is, the benefits of being a SAC member, the expectations as a member, and our commitment to global health equity, and how to get involved if you're not a current member. Next slide, please. So what is SAC? SAC is a student-led advisory council for IIGH. Our main goal is to engage students across campus, foster leadership, and promote global health equity. We also aim to have a multidisciplinary representation from various USC schools and departments. So we have members from the School of Pharmacy, from Engineering, Annenberg, Dornsife, Keck. Some of our regular activities include monthly meetings, lunch and learn sessions with IIGH faculty, global health workshops, and student-led presentations. Next slide, please. So there are several benefits to being a SAC member. You can help shape IIGH programming and influence student-focused initiatives. We also offer tailored professional development workshops related to global health careers and create networking opportunities with faculty, global health researchers, and practitioners. And then most importantly, as a SAC member, you get to be a part of a community of like-minded students who share a passion for global health. Next slide. So SAC members act as ambassadors for IIGH. We actively promote events and initiatives, and we support global health equity by spreading IIGH's mission within USC and beyond. SAC also provides leadership growth opportunities through networking and organizing workshops. So for example, last spring, we had a workshop with one of the leaders from the UN Global Coalition on Youth, Peace, and Security. He had helped to successfully advocate for the historic UN Security Council resolution for youth, peace, and security. And so we got to kind of have a private session with him and learn some peace building techniques and talk about how violence impacts global health. And we've also had young global health professionals come and speak to us about their experiences working in the field, and they've come to some of our SAC monthly meetings. And then last, we just aim to engage broader student participation in global health efforts through events, partnerships, and outreach with different student groups on campus and tabling across campus at events and things like that. Next slide. So to get involved, you can keep an eye out for workshops and events that are open to all students, not just SAC members. They're not as frequent, but we did have one last year. And then you can attend IIGH events whenever possible. And then typically applications for SAC membership will likely open in, or they typically open in the August of the year for that academic year. So the next application cycle will probably open August 2025. So consider applying if you're interested in joining. And next slide. So thank you for your time. If you have any questions or want to learn about SAC, please feel free to reach out to me, and my email is right here. Thanks, everyone.
Thanks, Anju. That was wonderful. And Dr. Burkholder and I would now like to open it up to questions from the audience. Please put your questions in the Q&A function. And if you have questions for any specific students, please make a note. We have one question right now from Dr. Ferguson. She says lots of nice things about all of you, so hopefully you're reading that. And then asks, can you say something about one way in which your thinking about global health or how you think about your future career has changed as a result of your experiences with IIGH? This is a great question. If any of you want to come off mute, then Caitlin can pin you as well. Yeah, Irina, go for it.
Sure. Can you hear me? Okay. I'll take this one. I think for me, I couldn't even imagine that some of these careers of the people that I got to interact with existed. I didn't know they existed. I didn't know about this world of global health and people engaged in research and policy and all of these different aspects. It was just something entirely new to me, and it's something I don't think they cover in like career classes in school. So the experience really opened my eyes to that, and something that I can't see myself doing something else in the future. So yeah.
Thank you. And does anyone else have anything to add? Anju and then Maggie.
I think for me, when this is more in regard to my Bremen fellowship, but I also did my fellowship in Kenya, like Emily, and we had separate projects. But I think one of the biggest things that I learned is that we can go with this idea of what we want to do and what we think is this big challenge and problem for the community. But when you actually get there, that's not actually the case. Like, yes, it may be a problem for the community, but that's not what they view as the most pressing problem. And so I worked in a rural area as well, and with pastoralist communities. And what I found is what I thought I wanted to do was not necessarily pressing for them. Like, that was not the need. And so that really shifted my perspective and my focus a lot on like what I wanted my future research to look like. So I did go to Kenya with an open mind that I'm really going to kind of understand what the challenges are so I can effectively make impact and help the community I'm working with. And there's some sort of like reciprocity.
I guess for me, working with like in research, especially with IIGH, first thing I never even imagined that I would even like pursue research. I always thought I was pretty much set in like medical school. I was very like pre-med, and then I came into global health like completely by accident through like talking to someone in my class, and I don't know, just seeing them talk about global health and like was just very inspiring to me. So I kind of got like, I guess like maybe that energy was contaminating. So I went into global health. I started researching, and I just discovered like how much impact I can make in studying these things and studying behaviors and studying like how social norms affect our health. And I think like I understood that as a future physician, like I have an obligation to recognize these interactions. And I'm very much committed to like studying it more, either through getting an MPH or a PhD. And again, I think just like being part of this institute has opened a whole new world of like health to me, and it being not just a biomedical like, you know, disease, whatever virus, but it's just like how many other things affect our health, and our lived experience is so important in recognizing that. So yeah, I'm again eternally grateful to being part of this institute.
Thank you, Maggie. Anyone else have anything right now? Or any other questions in the audience? And then we have a question from Rahanatu. Did you have to come with your own project and collaborate, or within the program, do you get assistance with finding your research interest? This might be helpful for some of the Bremen Fellows or the DC Policy Fellows to come offline or come off mute for this one. Yeah, Jonah.
So I'm sure there's differences among the different fellowships, but at least for our DC fellowship, we were paired with a nonprofit or governmental organization. I got paired with an org called HelpAge USA, which advocates for the rights of older folks nationally and internationally. And they basically told us what they needed. They said, hey, we want to do something with older women. We want to do something with lower income countries, and then kind of help me shape my research through that. So it wasn't just me coming up with my own thing by myself.
Great, thank you. And Emily, I know Emily has to keep her camera off because her computer battery is dying.
Yes,
but
sorry.
feel free to come off mute.
I thought I packed my charger today. I'm in the hospital, so sorry about that, y'all, but I'm still here. In regards to the question about coming up with your project and how do you do that, for the Bremen Fellowship, I think it was a little bit of a mixture. I definitely came into it with a pretty clear idea of the topic I wanted to work on and where I wanted to work on it. And then I had a long-standing relationship with my like local partner where we had been kind of in discussion about this topic and potentially coming up with a project for a couple of years. And so when the Bremen Fellowship opened its application, it seemed like the right time for us to kind of design something that fit within the guidelines. But I also had a lot of support and mentorship from Dr. Burkholder and Dr. Ferguson in terms of identifying exactly what of the many things that would have been possible to do would be feasible and effective, and then making sure that the scope was reasonable. So I think it is a fellowship that seems to have the opportunity to bring your idea to the table, but there's a lot of support in developing it out.
Thank you. And Dr. Burkholder, we're almost ending time, so I'll pass it over to you.
I see that we're at the end of our time here today, and apologies to a couple people who may not have had their questions answered today, but I'll try and touch on a little bit here as we close it out. I hope you all are leaving this as inspired and energized as I am. I want to thank all of our participants for their partnerships in tackling inequalities in global health with the Institute, and for sharing their experiences with all of us here today. For the students in the audience that are hoping to get more involved, please keep an eye out for the many of these opportunities that have been talked about to be posted very soon. We're coming up on that time of year. The easiest way to find out about these and many other ways to engage and to connect is to subscribe to our mailing list through the website, globalhealth.usc.edu. And this is where we always post advance warning for any new applications that are opening or opportunities that you might be able to engage with. And speaking of opportunities, a final quick plug to register for our upcoming virtual event in our 5th anniversary series, which is taking place on November 13th. It's an impactful panel on protecting equal rights. So thank you all and have a wonderful day.